Because Dennis's dementia was more advanced than Sarah's, advanced planning with him was more difficult. He was not interested in the Alzheimer's website and didn't seem to track the information his daughter gave him to read. After the family meeting described in Module 6, both daughters read the materials highlighted in this module, that is, the ADRC website, the Alzheimer's Association, and Oregon Health Decisions Planning Guide. Their options counselor also suggested Making Decisions for Someone Else, a how-to guide published by the American Bar Association Commission on Law and Aging. Dennis's daughters used many of the forms in the Oregon Health Decisions Guide as a checklist for themselves. With Dennis's help, they were able to locate important legal and financial documents and over several weeks were able to get them in order. As with the person-centered plan developed to support Dennis's routines, advanced planning with Dennis continued to center around informal conversation and observations about what was important to Dennis and how he wanted to live. Talking about his wife gave Dennis pleasure. His daughters had avoided talking to him about her death because it made them all so sad. Now they would share happy memories and occasionally would ask him about the time she was sick and when she was dying. They asked whether he would want care in a similar way or whether he wanted something different for himself. His daughters were surprised that Dennis was willing to talk about this, and through these conversations they were able to identify many of his wishes and values. They learned more about his thoughts about the quality of his life. They started to talk with Dennis about helping him with some decisions. They stressed that they would help him to stay at home, and then told him that it would be easier for them to do this if he gave his permission for them to make decisions. When they asked him if he wanted to make it official that they would help him with his finances and his health care, he thought and said, "Well, that would be all right, it seems fair." Over breakfast one morning, his most alert time of the day, they talked to Dennis about making Sally his health care representative and Lola power of attorney for finances and property. Because Sally lived closest, they also decided to add her name to Dennis's checks. In this instance, this made a nice check and balance for finances. Dennis read the documents with them and they discussed and answered his questions. Other trusted people, including his friend Fred, were there to witness the signatures. An important lesson Dennis's daughters learned was that making decisions for someone else entails doing as much as possible to support what that person would want, and not necessarily what they thought would be best for Dennis. Both Sarah and Dennis were fortunate to have supportive family. Even though Dennis had a tense relationship with his daughter when we first met him, she was not neglectful. She could have been considered verbally abusive, but once she learned more about dementia and got more support for herself, the conflict with Dennis began to subside. However, as we discussed in the Tier 1 training, when someone's capacity to make decisions is questionable, there is a risk of abuse. The Office of Adult Abuse Prevention and Investigation recently released its annual report on abuse statistics for 2013. Over 4,000 cases of substantiated abuse of elders were reported. Most of this occurred in community settings, another 25% in licensed facilities, and 18% through self-neglect, again, of people living in the community. It's hard to know exactly what the actual prevalence of abuse is. There are not really good statistics on that. As you can see, nationally the estimates range from 28 to 62% of older adults being abused emotionally, nearly a quarter physically, about 20% in terms of neglect, and about 15% financial. Of the substantiated cases found in Oregon in 2013, we see different figures. 44% were from financial abuse. The next level was neglect, verbal abuse, physical abuse, abandonment, sexual abuse, and then other. A recent study found that many caregivers were concerned about becoming violent, 20% in this study. This reflects both the burden of caregiving and possibly a lack of understanding about dementia. Other researchers found evidence of abuse and neglect in nearly half of the caregivers they interviewed. At the same time, no clear or consistent profile of an abuser emerges in the literature. A history of conflict with the person, as well as disruptive or aggressive behaviors on the part of the care recipient, may be factors. Financial exploitation is a very common form of abuse, as we have seen in Oregon. One national study reported 15% of people with dementia have been victims of financial abuse through cold calling, scams, and mis-selling a product. It is likely that without the vigilance of caregivers, that number would be much higher. 70% of caregivers reported that telephone callers routinely targeted the person they cared for. Professionals who come into contact with people with dementia should always be alert to the possibility of abuse. Behavioral signs of distress will likely be the most useful symptoms to watch for. Often, multiple agencies and people from different disciplines may interact with the person. Assessment from multiple disciplines, as well as memorandum of understanding that supports multi-agency collaboration, are approaches that have been successful in identifying and preventing abuse. Targeting caregivers as part of abuse prevention is promising, even if there is little research evidence supporting one approach over another. Some promising actions that have emerged in some studies include providing support for the caregiving role. This includes acknowledging the work and helping the caregiver get assistance. Helping caregivers understand the behavioral expressions that are so often distressful to them and the person with dementia may be especially important. Respite care and reducing isolation of both the caregiver and the person with dementia have been effective in many situations. Although Dennis and his daughter Sally had a lifelong history of arguing with each other, her increased ability to support Dennis was apparent in Module 7 as she described her father's hospitalization and experience with delirium. For the most part, her relationship with her sister also improved, although they continued to get irritated with one another at times. Still, they were able to agree on how to support Dennis through advanced planning. In some situations, the advanced planning process with people with dementia may be doubted if there are questions about who has authority for making decisions, or there are concerns that the person named as decision-maker has taken advantage of the individual with dementia. Here is a daughter who has suggestions for how to demonstrate that a person with dementia has capacity to make decisions about who will represent their interests and their willingness to name a power of attorney or a healthcare representative.